The Veteran Lived Experience series features personal conversations with veterans who have agreed to share their story on topics prevalent in the veteran community. Veterans are joined in discussion by professional experts and members of the Veterans Health and Wellness Foundation team.
Good afternoon, everyone, and welcome to the Veterans Health and Wellness Foundation's Veterans Lived Experience Series event. As you know, as some of you may know, my name is Dr. Evelyn Lewis, and I am your host, and I also serve as the president and chair of the foundation. The Veteran Health and Wellness Foundation is a nonprofit 501c3 charitable entity that was established by military veterans with expertise in the area where wellness and healthcare delivery intersect with the social determinants of health and military culture. Before I tell you about what we do and our mission, let me tell you about our why. We look to create a world where enough passion, purpose, and commitment from all of us that will allow all veterans and their families to live healthy and well lives that's undiminished by their service-related health concerns. So what is it that we do? Well, what we do is embodied in our mission, which is to build, educate, and maintain resource networks to support the complex physical, social, and emotional health needs of veteran communities across our nation. Our vision seeks to expand the number of communities that possess the knowledge and capacity to not only identify and address service-related health challenges, but also to embrace, support, and empower the veterans in their communities and their families who experience those issues. So bottom line up top is a reflection of our why. In other words, we are here for veterans and their families to be their best selves. The Veterans Health and Wellness Foundation strives to expand opportunities, again, for them to live healthy and well lives that's undiminished by their service-related health concerns. Today's topic is on transition, or reentry, as some people call it, and its impact on our veterans. I'll give you a little bit of information background about that before we begin the talking with our guests. So if you will, military service, as we know, can be difficult, demanding, as well as dangerous. But returning to civilian life can also pose challenges for those who have served in the armed forces. And this is according to a number of different studies, but one that I'll talk a little bit about right now is from the Pew Research Center that surveyed around 2,000 or so veterans several years back. While more than 7 in 10 of those veterans, or about 72%, reported they had an easy time readjusting to civilian life, 27% said reentry was difficult. Now, a proportion of that number grows to 44% when we're looking among veterans who served in the years since the September 11 terrorist attack. This begs the question, why do some veterans have a hard time with transition or reentry to civilian life, while others make the transition with little or no difficulty? Some of the things that they found as the answer to that question, or might contribute to the answer to that question, was that there were a number of different attitudes, experiences, characteristics of veterans that identified factors that were independent to predict whether or not that member would have a difficult or easy reentry experience. Some of the things they found and talked about were veterans who were commissioned officers and those who had graduated from college. They were much more likely to have an easy time readjusting to their post-military life than those who were enlisted or who only had a high school education. Others, veterans who said they had a clear understanding of their mission while serving, also seemed to have fewer difficulties with that transition. Veterans who said they had an emotionally traumatic experience while serving, or had suffered a serious service-related injury were significantly more likely to report problems with reentry, when sort of all of the other factors that everyone experienced were held constant. Those who served in combat zones and those who knew someone who had been killed or injured significantly also faced steeper odds of reentry. Another group, veterans who served in the post-9/11 period, also reported more difficulties returning to civilian life than those who had served in Vietnam, the Korean War, World War II era, or other periods between major conflicts. And again, those veterans who served in post-9/11 period also reported more difficulties returning to civilian life than those who were in Vietnam or the Korean War. Higher levels of religious belief, and they measured that by looking at frequent attendance at religious services and things of that nature, also showed dramatic increases in the odds that a post 9/11 veteran would have an easier time readjusting to civilian life. So as you can see, they looked at a number of different factors which contributed to this transition or reentry into civilian life. But there was no one huge factor that showed up or that was identified and isolated, if you will. But my guest today is Anne-Marie Halterman. I think you're going to find her very, very interesting, in particular her story or part of her journey. She's a graduate of the United States Air Force Academy, and she's here to share some of those important stops along her journey from what we're calling conflict to creativity. So I'm going to ask Ms. Halterman if she would speak to us a little bit, again, starting from your days of entering the service and sort of carrying across that journey to getting to where you are now. And then we'll just have some conversation in between there. So Anne-Marie, it's all yours.
Thank you. Well, first, thank you so much for the opportunity to join you and to talk about my journey and also my perspectives as a veteran and family member. And most importantly, that you're taking the time to do this. And so you're doing this not only for the veterans and the family members, but you're also helping the communities when you're working with these medical caregivers and helping them understand what veterans and their families are faced with when they're transitioning. So thank you so much for allowing me to participate.
You're welcome.
I never thought I would go into the military. No background, family background, nothing. But it ended up being the best option for me. Went to the Air Force Academy, played basketball, and really enjoyed the camaraderie and the teamwork that existed when I was in the military. I graduated and went into the civil engineering career field, got a master's degree, and then went overseas and went to Aviano, Italy. So that was a really tough hardship assignment. Actually, it was overseas the first time I'd ever really been overseas. So it was an interesting transition there. But in my time in the service, I deployed a lot, was in combat areas, humanitarian type relief opportunities as well. And then a lot of time just at base station, taking care of the facilities and the utility systems and everything from military family housing to the base or the fort's leadership facilities that they operated. And that was kind of my role in active duty. So I saw and met all sorts of people in my day-to-day job. When I was looking at leaving the Air Force, which I left right, but I returned from deployment after 9/11 and proceeded to transition at that point out of the military and into the civilian life. And I think like my background and experience, many people have either loved ones or others that have careers in the military as well. So you're not always able to pick where you're going to end up or like transition easily into an ideal situation because you have family obligations or other things that are going to draw you in locations that maybe would not be ideal, but you find a way to make it work. And so, I'm grateful for my time in the military. And when we talk about transition, I'm really excited to understand what your term, how you define transition with regard to military to civilian, but also just, that's a huge topic, the little breakout areas within that.
Yeah, I agree with you there. In most instances, I would venture to say that people, when we're having these kinds of discussions and we're talking about transition, we're looking at things from say uniform to civilian clothing, from the military kinds of duties, even though they're very similar jobs on the other side,
Right.
they're not quite structured in the same way or manner. And so going from that structure of the military, regardless of what your career field is, to that of a civilian on the other side. And that transition, as you mentioned, is a very broad word, because it not only means transitioning from military to civilian life, it also means transition from this family back to your family. Because the military, when you're there, becomes that family. It incorporates the other piece, but when you leave, it becomes very different, because particularly if you're somewhere, someone who deployed quite frequently, you know, it even requires a bit of a re-entry when you come back from deployment. So there's a lot that's in that word of transition or re-entry. And so thank you for bringing that up and helping those who are listening appreciate that it doesn't just mean, you know, one day you walk out of this door and into that one.
And I think I appreciate you defining that a little bit more clearly, because if I had taken part in a survey like what you said from the research that you were talking about, I would have probably 2 or 3 years out of the military said, oh, I had an easy transition. And everyone around me would be like, man, your transition was so easy. But actually, you know, I got out of the service in 2002. So I've had 22 years almost of time where I'm a civilian now, but I really feel like my transition, my successful transition, did not happen for 10 to 12 years. And part of that was, if I think about transition, you know, I think, okay, so like you said, going from wearing a uniform to wearing civilian clothes, that actually is a big deal for a nerdy engineer like me. That was a challenge. But also from finding the community and the support within the community that I had with the people that I deployed with and that were in my unit in the military. Finding my footing on not what job I could do when I got out, which I did go into civil engineering, by the way. So I stayed in that wheelhouse, but actually working in a profession that I felt meaningful and that I was of value of, and that I was proud to be part of. And so all these things, to include my family and their successful education as my kids were going through elementary, middle school, high school, all the way to now. You know, when I look at what is success as transition, or what were the transition points, I have continued to have those points, even though I've been out for 22 years.
Yeah, I couldn't
And I
agree
think-
with you more. I think a lot of people feel that way, including myself, actually, because it's, instead of transition, it's transitioning, because it's a continuous kind of process. And that you often hear people talk about, particularly when they're feeling lost or not quite got their footing, as you mentioned, that they haven't found their tribe. You know, that group of people who they felt whole with while they were in the military. And so a lot of what you're saying there, I think sort of longitudinally runs through the transition of most of us who have served. Whether that was difficult or not, it's still a process that everybody has to go through.
Well, and it's not just military that go through that process, right? Yes. So civilians have the same thing. And we all started as civilians and transitioned into the military. Basic training and career field training, things like that, helped us kind of adjust to the daily life of being in the military. Well, I was 18 years old when I basically made the decision to go into the military. So when I was getting out of the military, I was a different person than when I had, you know, left my parents' home and went in the military. And so that transition was a foreign concept, because I was now an adult stepping into a world that really, from college and my military time, I was very sheltered in some ways. Because like in college, I didn't have to rent an apartment. I didn't have to pay utility bills, things like that. And of course, I gained some awareness on those things as I went into the military, like when I got to my first duty assignment and things like that. But then picking where you're going to live. Well, I never had that opportunity because the military told me where to go. You know, I look at the process of transitioning and other than those who give the ultimate sacrifice and lose their life in service, well, went from civilian to military, and we go from military to civilian. And for me, a lot of that transition, when I look back on it, is what I define as a life worthy of living.
Mm.
And I say that because it's tough, right? I mean, mental health, physical health, as we age, things, we have more medical issues, but when we haven't addressed issues, or when we weren't even aware that we had some issues from when we were either kids or in the service, those can kind of derail a successful transition. But everyone may look at it from the outside and say, wow, that person's transition was so easy. It was seamless, when
Mhm.
really that person internally is struggling, and just trying to find, like you said, their tribe and live authentically, because everyone's been telling you who you are and what you do the entire time you've been in the military. And so now you have this freedom, and it's scary, and and what you think you want versus what you want. I mean, we all go through that, right? It's like a process. But I do think the interesting thing about transitioning from the military to civilian life are the programs that are available to help in different sectors of transitioning. So from a family standpoint, from a work standpoint, and from community and choices that we get to make, there are a lot of entities and individuals and programming to help us with that. Like, for example, your program,
Mhm.
Veteran Health and Wellness Foundation, and Warrior Centric Health.
Mhm. Mhm. Yeah.
And so in your experience, how is someone to justify prioritizing? Is it the job? Is it the location for their family? Is it, is there a single answer for how to transition?
Yeah, I don't think there is. And I think one of the deficiencies, if you will, that we have seen in regard to the various programs that the military offers or that even other organizations offer is we often approach this defining it for the person as opposed
Right.
to allowing the person to define it for themselves.
Right.
And when we define it, then we're looking at, from going from A to B and from B to C. And oftentimes the emphasis is on that job. It is on
Right.
where you're going to live. It is on what you're going to do and where you're going to do with your family and this, that, and the other. And it's all that sort of regimented piece as it trickles down from the regiment that you were just a part of. And so I do think, in light of having a number of different conversations and some of that with you, is that one of the things that we may be doing that hinders folks or could indeed make that transitioning a little bit more difficult is that we impose a definition of that on them as opposed to allowing them to really think, what does this mean to you?
What are your priorities? I think that a lot of times there's a lot of pressure when transitioning from, as you're going through your career and getting promotions or things like that. There's a lot of expectations that you're going to continue to climb the ladder, and that will provide, financial security for your family and the future of your kids' education and things like that, right? Which is all normal. And I think what we maybe don't take the time, or I didn't take the time to figure out when I was leaving the military, and probably did not have the capacity to figure it out at the time, was what is important to me? What do I value? And what do I consider success? And that it didn't just involve me, it involved the people around me. And that's a tough question. You value your family. So if that's the case, then what do they need? Because family members, spouses, they give up a lot, and they don't get the recognition that the veteran received. And so is it their turn? And what does it look like? And how does the veteran play in that role and facilitate, a priority that supports everyone in the family? And I think, there's, like you said, there's like all these transition programs that the military does and a lot of great nonprofits. But ultimately, there's not one solution. There's not one path.
Mhm.
And I guess in that way, veterans are super lucky and fortunate to have such a basis of foundations and corporations that support that transition in different ways.
Yeah, I agree. I agree. I agree. So in thinking about that transitioning, what was that like for you on a very sort of personal level? You mentioned your kids, and we've talked about, the family in terms of, particularly when you're the veteran, the family, as you said, often gets put to the side here, and they just have to come along as things are determined where you need to be or what you need to be doing. So they're often secondary to this career in the military. So on a sort of maybe deeper personal level, how did you manage that, or how are you managing that, if you will?
I think it's a constant manage. Kind of like you said, transitioning versus transition. How was your transition? Well, people are constantly transitioning. For me, it was really delayed. A successful transition was significantly delayed because I had an easy career field that could apply directly to the worldwide, that wasn't just limited to the military. So for people that have a very heavily defined career field with military requirements, it's harder. And I think you said that even like people that had undergraduate degrees report having easier. A lot of that is because of the education and the qualifications that they can check based on their training and education. And so for me, I was an engineer. So I went into engineering. I didn't think about, to be honest, I personally did not think about what do I want to do. It was more, what can I do? And I felt the pressure to make that decision, find something that would be considered successful from a career standpoint, and to, move forward with that. And I'll tell you, my commander at the time made a comment to me that stuck with me for a really long time. And he said, "You're never going to make as much money in the private sector as you do being an engineer in the military." And that, at that time, when that was stated to me, I was like, "Oh, I'll show you." I thought it was a very negative comment. And so, getting out, transitioning, finding that job that would be challenging and a demand, but also seen as improving my career in my same career field, was influenced by even like a basic comment like that from somebody.
Yeah.
And that happens. And at the time, I did not have kids yet, so but I did shortly after getting out of the military. So they were young and I didn't have as many requirements in that area. But what I've found over the years is when they entered the picture, finding the location to live, supporting them in a community that offered activities that they could excel at, that they would be invested in and wanting to participate in, is really tough when you're coming out of the military. And all you've ever maybe done is lived on or near military bases. And so for me, I actually needed medical care that I didn't realize I needed. And so when I got out of the military, I went through my VA assessment and I was a disabled veteran, but my PTSD, my traumatic brain injury, were not identified right away. And so when 1 + 1 didn't equal 2 for me, I would just work harder and, to make, oh, I can do this. Why is it not adding up? And so it took, like I said, over a decade for it to be diagnosed, for my injuries to be diagnosed, to have the right healthcare providers that could assist me, both not only just TRICARE and VA, but also some community care network providers from the VA. And I think because of my military background, there was a delay in identifying it. Because I think from a medical perspective standpoint, I wasn't really being viewed, other than the VA, but I wasn't really viewed as a military member or a veteran that might have combat injuries.
Mhm.
And so I was being treated as like a spouse or as a non-military background. And so, I mean, I didn't know any different.
Yeah.
But it took the system a while. So personally, that was really a lot of growing pains to go through.
Mhm.
But again, through this web of services and medical staff that, started to realize there's something going on here. I was able to participate in some activities that helped me be able to articulate how I was feeling. And it was through therapeutic arts. But it wasn't called therapeutic arts because I'm an engineer and not an artist.
Mhm.
And I began to be able to put pieces together that were gaps. And I had the medical support to do that. And, I was fortunate. So I look at a lot of veterans and, what it looks like, how their transition looks like it went or how it's going. I always wonder, are they where have health and wellness and they're engaging and they understand the value that they have.
Mhm.
And it took me a decade to get there.
You were talking a little bit about this how it took about 10 years to get that diagnosis of PTSD, et cetera. During that time, you were obviously getting some medical care. What was that like, particularly outside of the VA? Because we know if you're getting care in the VA, they know you are a veteran. They
Right.
they will gather what your experience has been, et cetera. But in the civilian sector or in the community care environment, that may not necessarily be the case. And one of the things that the foundation does, as well as Warrior Centric Health, is we're on this crusade to get healthcare professionals to ask the question, are you a veteran? Have you served, been in the military, that kind of thing? Because if you do that, then there is another sort of pathway you may need to go down with that patient. So
Right.
were you ever asked that question? And if so, was it pursued in a way that you thought it should be, so that it kind of expedited your ability to get the care that you needed?
Yeah. So I will tell you that the answer is no. I was not asked that question. But so my exit from the military was October 2020, October 2002. Sorry.
Mhm.
And that was at a time when the VA did not ask questions like, was military sexual trauma something that happened? They were not looking for, when I did my out processing from the military, they didn't give me an eye test or other things that would have helped them reveal the fact that I'd had a traumatic brain injury when I
Mhm.
was deployed. And so those questions didn't exist yet. So the system has gotten better, right? So through the years, I think the VA, the DoD, I think some light has been shed on, wow, we should be asking some questions that would help us better understand.
Mhm.
But also understand there's a lot of shame and unwillingness to talk about things
Mhm. Mhm.
that makes it for a healthcare provider almost like they have to read between the lines.
Mhm.
And so the more that there are programs to help medical providers understand that
Mhm.
and why maybe a veteran that has been sexually assaulted would not speak up because of the framework that they lived in for so long during their time in the military, that can help, I think, reduce the amount of time that it takes to figure out what's really going on.
Yeah.
So is it a sleep issue or is it a
Mhm.
sleep issue caused by, or what's the residue symptoms? And to
Mhm.
try to find that and almost be like, I don't know, kind of like a private investigator, like you're figuring out, cracking the code, because everyone has their own experience. And so there's not a one solution for everyone.
Yeah, I've done a number of these, what we call Veteran Lived Experience Series events, and had several veterans who had the experience of military sexual trauma while they were serving. And interestingly enough, there's never been one that hadn't gone at least at a minimum 12 years without saying something.
Right.
And some have been much longer than that. And during that period, from that experience until they finally said something and began to get some assistance, many lost their homes, they lost their families, they ended up on substance use disorders, all kinds of things happening simply because, and I say simply, obviously it's a complex issue, but simply because that communication between them being able to say, this happened to me, and that provider being able to say, okay, let's get you the help you need. So
Right.
that small connecting piece, that single connecting piece that did not happen, allowed years of loss and suffering to occur that was potentially totally unnecessary.
Yeah, and I want to point out though, I just sorry to interrupt you, but
Go ahead.
in my experience, especially in the capacity as co-founder and executive director of Uniting Us, it's not just women. It's amazing.
Oh,
You know, I
no.
mean, I think people will hear MST and it's not something new. It didn't start happening after 9/11. It's been going on for ages. And you know, World War II, Vietnam, Korean War. I've talked to many men and women that have been impacted by it. And so, yes, I agree. The ability to get someone to talk about it is a challenge because the nature of the military is so well, for me, my experience, if you talked about it, if you reported it, there could be and would likely be serious retribution. So now when you're a civilian, hopefully that doesn't still exist. So
Well,
how can we?
unfortunately, it does kind of translate or continue, if you will, into that sector. I remember talking with one of the guests around that, where one of her healthcare professionals finally did ask in some way, did she have uninvited experience?
Yeah,
And she responded yes, and she said she fell apart then because she was just so happy somebody finally asked her.
that's a great way. That's a great way to phrase the question, because if someone says, did you experience MST? Well, military sexual trauma is a category or classification created by the VA, I think, to kind of actually cover a lot of ground. Could be everything from just being verbally harassed. I'm not saying anything like that's not bad, but all the way through brutal rape.
Yes.
And so I think asking, you know, was there activities that you did not want to participate in? I think that's a brilliant question.
Yeah. And I appreciate you ensuring that those who will be listening to this or who are listening now understand that it's not just women. I've also had men on as a part of one of our guests around that same topic. And if you look purely at numbers, because there are more men in the military than there are women, their numbers are greater. When you look at percentage wise, then for women, the percentage is higher. So it is one of those issues that healthcare professionals really need to very much understand, that those are issues for anyone who has served in the military, and that they should incorporate that question very early on in their relationship with their patient.
Yeah, and I think that's helpful. And the other thing that I found for me particularly was participating in activities, actually Wounded Warrior Project and others, where you go and you with a group of veterans and you go ride a bike for a weekend type thing or things like that. So it's outdoors, it's super, laid back, just really a chance just to kind of chill. For me, I experienced, and it is actually what I think helped me make that jump from, I can't make 1 + 1 = 2 to realizing, well, this isn't a numeric solution. Like this is like complicated. It's like algebra. um, and so it was hearing other veterans talk
Mhm.
about their injuries, their issues, what doctors and what treatments they were getting. And and to be honest, I was an officer. And this group that I was with were all enlisted except for me. And at the end of the weekend, I remember thinking to myself, why is it that I can't talk the same way they do? Why can I not express myself in that way? And that was an obstacle for me. And it
Mm.
was, a lot of officers, I've heard them say, or prior officers, veterans will say, well, those programs are for the enlisted people. And that's really another thing, that divide between, officer and enlisted.
Mhm.
Um, that becomes a barrier to access to programming that's intended for everyone, and not just the veteran, but the veteran's family as well.
Mhm.
And so to me, activities in a tribe type environment helped me realize, there are people that are able to verbally talk about things and work out and actually like share information, and others are helping them trying to connect the dots.
Mhm.
And that was like a whole revelation for me. I was like, had no idea.
Wow. That's very interesting to hear, because we do within the military make a very stark division between officer and enlisted. And it's often difficult to overcome, even once you're out, as you mentioned, going to those types of events, if you will. And how do we blur that line when you get
Right.
out, so that you can have more of that interaction when you're together in situations like that?
So, and I agree exactly with what you say. How do you change the environment, right? So the focus is not the same structure as what was in the military. So let me just, I want to not fail to mention, there are companies out there, if we're talking about transitioning from work into a good work environment, whether it's a new career field or staying in the same field or area. Companies like Leidos, they're a huge company, and they have one of the most aggressive veteran and veteran family member hiring programs. And it's a transition program to help the veteran and their family members find meaningful employment. And they spend a lot of money on it, and it's very successful. And they're not the only company by any stretch. There's a lot of companies that are doing that now, which is hugely helpful. And that benefit of having it now transferring down to the spouses and the family members, is starting to open doors for people that have been moving around from location to location following the military career
Mhm.
and limited on what they could do. Um, and like, I want to just, the other thing is medical, your program, what the VA is doing, what the DoD is doing. There's a lot of programs out there that are asking these questions and having discussions like this. So I appreciate this opportunity. I think the one thing that, if I was to say, how do you blur the lines between officer and enlisted, or between the gender, male versus female, right? I think the answer is in the community. And that community is through activities and participating in events that age, race, gender is irrelevant, an inclusive community.
Okay.
And so when I was making my transition, I realized that uniting us for me was about giving other people an opportunity to experience an environment that was not typical for them. And so what we do at Uniting Us is we allow veterans, military, and their family members to provide them with opportunities to, do arts, whether it's, performing arts, visual arts, and that a lot of nonprofits do that as well. So people are participating in creating these really amazing programs, not programs, but pieces of art, and then let them tell their story of how that art came about. And that's really what Uniting Us does. And that's our capstone, is getting a really diverse population of people together, having the art and performances, and then allowing people to talk and to have the environment set up where it's safe, where they can talk about and start to refine their narrative. That is not about that they were an officer or that they were enlisted, but about when I was deployed to this location, I saw some things that I struggle with, or I had to do some things that, and other people are sitting there and they might not have the exact experience, but they can relate and it helps them to start the other people that are there just as guests and viewers, and, they're passively involved, but now they start to interact because now they have an example of what it looks like, kind of like what I did when I first was with that group with Wounded Warrior Project. And they can start to articulate. And then through that understanding, we continue to develop relationships with other nonprofits, organizations that are trying to help make it possible for everyone to have wellness and health in their life, military or not.
Tell me a little bit more about how someone gets to your organization. Are they referred there by, someone who has been there or knows about you? How does someone who may or may not even be struggling or with that transitioning process, how do they make their way to
Uniting Us? It's interesting because the pathway to community programs so many times are word of mouth.
Yes.
And we are an organization that, and we're veteran created, and so a volunteer organization. So we collaborate with a lot of other nonprofits and entities that are trying to improve lives, both from a mental health standpoint, as well as family and community, being stronger together. And so we have a website, unitingus.org, and that's unitingus.org. And we also have a Facebook page. We have a lot of information that goes out. We partner with the VA, with the DOD. You'll see exhibits of the artwork and programs that we do in the DCA National Airport, in Dulles International Airport, Walter Reed, Library of Congress. I mean, we have art, and now when people hear this, they'll be like, hold on a second, I've been walking past this piece of art for 3 years and now I connect. It's like when you're naming a baby, how do you, never heard the name before, and then you name your child that name and you start hearing it and seeing it all over the place. But, friends and family bring people. Sometimes it's random, like someone just happens to be in a place where we're doing an event, an activity. And ultimately, people get to choose how they participate. They can come and view the art or the performance and just be in the same place as everyone else, all the way through to participating in perhaps either with Uniting Us or another partner organization that then ultimately might be a community project that's a big mural. So we have like murals that are 8 foot by 16 foot long, and 300 plus people were part of making that, led by veterans and their family members.
Wow.
And so, it's about bringing community together regardless of what their military status or background is. And so I think the best way to learn more about Uniting Us is to go to the website, and that for people to see when we have a program, bring a couple friends and check it out. You might think you're not an arts person, but it's really it's really engagement, not always just about the art and the stories that people and the courage that they have and the willingness and how art can help people heal and find connections that otherwise in their day-to-day lives, whether it's at work or at school or whatever, they would maybe never have the opportunity to explore.
So when one is thinking about these kinds of things, some people might default to, well, I can't draw anything, or I don't paint, or those
Yep.
those kinds of things. But I guess through word of mouth, as you mentioned, they might be more encouraged by what they hear from a peer or from someone who's participated, and then venture to come in and see what's happening there. Once that happens, once they get there, do you find that what's their typical level of engagement, after sort of those first couple of visits, if they choose to come back? What do they end up doing? Do they become a part of Uniting Us in terms of, continuing with the visual arts or dance or theater or what have you? Any of the activities that you all offer, do they continue with that? Or is it like therapy, if you will, after you've had so many sessions and you're sort of out and you're kind of trying to see if that has worked or helped you?
Well, if the framework for our organization is built on what the participant or the person that encounters Uniting Us wants or needs.
Okay.
And so there are programs that you wait a year, you go to a program for a weekend, and then you maybe never hear from that organization again. We wanted to avoid that because it's about having a community. It doesn't necessarily mean that we live right next door to each other, but having a community where you found support and a shared experience, that someone else is there. And the suicide rate, all the things that we battle with that, as well as advocating and identifying problems and issues that are happening, so that in Congress and in policies and things like that, they can be considered for how to overcome some of the limitations or the things that are happening that maybe most people don't want to talk about. Our art provides that opportunity as well. But I can tell you, I'm not an artist at all. I'm just a person that passionately believes that I can make a difference in the community. And I do it by trying to help other people to see different avenues or different ways that they can be connected. Not everybody wants to be connected. But what we do find is even someone that, I'll tell you, recently we had someone that attended one of our events, had no idea what they were walking into. And at the end of the day, she came up and she said, I had no idea. My dad graduated from West Point, went to Vietnam, and struggled his entire life. He sang in a choir, but he struggled. He never would talk to his family about his Vietnam experience. And she's like, I was just walking by. I walked in here and I saw and I talked to the artists and the other veterans and the visitors, and I mean, my gosh, my dad would have been able to live a quality life. And now she's a volunteer. And and so she that's how she chose to continue to be engaged. So she comes to our events, she volunteers helping prep art or organize events and things like that. A lot of times what happens is, I think veterans hear about it or a friend bring them and they have no intention of coming back. And then something happens, like a lot of times at our public events, we have murals being created and everyone's invited to participate. And it will be a massive undertaking. And everyone that's there that wants to can participate. Well, then they want to know, well, what's it look like? What did it finish looking like? Oh, you wanted to see that. Okay, so we send that out. And then it's like, oh, well, that's going to be hanging up in, let's say DCA airport. Well, where in DCA airport? Because I'm flying out of there. And so then they can see either the image because we post it, or they go see it and they're like, I was part of that. And regardless of whether it was one little brushstroke or a whole section that they were part of. They were part of something that other people are looking at and valuing. And so it catches people off guard, which is in fact how I got involved in the arts. I didn't see it as the arts. I saw it as, wow, I really enjoyed that discussion. And, you know, I'm not an artist, but I am creative. So, you know, I think that everyone has creativity and you have different ways that you can participate. We do, and another, here's a good one for you. 2 women veterans, both of which had their own struggles. One was an artist, the other one was not. But the other one wrote a poem that we exhibited. And this was several years ago, like 4 years ago. They just published a book together. They didn't know each other. They're not from the same state. They were from different services. They just published a book together called Latina Warrior. And Lisa Furman wrote the poems, and Christina Helfrich Pulaski did artwork for every poem.
Wow.
And they are going, and they're on this speaking tour that goes to universities and to companies and stuff like that, and talking about how their opportunity to meet each other through a veteran nonprofit has led to them being able to heal and basically meet a level of success that they never thought was possible. And to be able to talk about military sexual trauma or challenges with being part of, you know, the Army as a service or Air Force or, you know, whatever. And they're sharing that with other people. And that to me is what it's about. It's about inspiring other people, getting that word out.
I couldn't agree with you more there. And in particular, because they will likely attract people to those events who are not necessarily military. And what I've noticed and found out over the course of time is that there are a lot of people who have no idea what it is to have been in the military or had someone serve in the military or been in the military themselves. They just have no even place to start from in terms of what that's like, what it means, and why we need organizations like the 2 that we both are engaged in to facilitate some of the issues that veterans face once they are finished with their careers within the military. And so those kinds of opportunities where people are going out and having these kinds of events allows for others to hear some of what is happening. So I'll ask you a little bit more about that in the coming days, so that we can potentially become a part of, you know, promoting that and
Working together.
Know about it.
Well, a big part, Evelyn, as you know, is just for people to be exposed to the information, right? So you are phenomenal at how you do what you do. We have a different approach, but ultimately it's getting the same type of information out. And so we have platforms that allow us to have more 50 million viewers a year of our program. And it doesn't spark with everybody, but it does start a discussion. It starts being present for people to consider kind of some of the issues for veterans, or issues that are not just veteran specific, that they can connect to. And the more we work together as organizations and as people, the better understanding we'll have, the better the programs will be for medical, for work, for family members. You know, and so I appreciate the Elizabeth Dole Foundation's your work on the medical side, and others that are striving to make life better, whether it's for veterans or not, improving the quality of life through health and wellness.
Well, it will take all of us, that's for sure.
Yes.
It will definitely
We
take.
can't do it alone.
Indeed.
Can't do it alone.
In the couple of minutes or so we have left, one of the questions I think I want to ask you is, now that you have come through a lot of the things that we've talked about, you've talked a lot about some of those points or stops along the way of your journey. What would you today tell the person who left in, what was it, 2002? What would you say to that person to help them understand that they could get from there to where you are now?
That is a poignant question. I think that I would offer myself, words of advice of be courageous,
Okay.
be, do something that you value and you think others would value as well. And that might mean addressing some issues that
Mhm.
you either are running from and or that you might not even realize yet. But just be prepared and know that there are other people out there and you'll find your way.
Yeah, when you said the words "be courageous," that's where my mind went, in terms of if you've had some experience in the while serving that wasn't positive, whether it was traumatic, whether it was MST, whether it was traumatic brain injury, whether it was viewing some action that shouldn't have been happening, or whether you participated in some action that shouldn't have happened. We talk a little bit about moral injury in the work
Right.
that we do. So if you've experienced those things when you're coming out and beginning that transition, the words "be courageous" applies to allow yourself time, allow yourself whatever you need so that you can adjust and address those issues so that you can then proceed and make their way to a place like where you are now.
And I think a lot of times we limit ourselves.
Yeah.
We are self-limiters that are worried. We're programmed from the time you're born, where you're raised, how you're raised, going in the military. And I think it really takes a lot of openness to overcome that and say, okay, if I continue to limit myself, the healthcare providers, my work, everything along those lines will continue to be limited, not because other people aren't there to help me, but because I limit.
Mhm.
And that's where the courage comes in.
Yeah, I agree with you. Well, all I can say is thank you. Thank you for joining us today and shedding some light, some insights that we may not have been considering on this topic of transition, which we have obviously discussed a little bit more and call it now transitioning because it's
Right.
a process that we continue to go through. We continue to evolve. And I know that for myself to be true. You retired, left in 2002. I retired in 2003. And so I'm still doing that. I think that
Right.
process is a dynamic one. And so thank you for sharing your experiences and a part of your journey. And I'm sure that the folks who will be listening to this in the days to come will find it inspiring, encouraging, and get them to a point where they are seriously considering addressing some of the things that they need to. So thank you
Yeah,
again.
there's people there. Yeah, thank you so much. I appreciate everything.
Okay, we'll talk to you again soon.
Sounds good.
All right, take care. Bye-bye.
Bye.